My name is Humphrey Zokufa. I'm the Managing Director of the Board of Healthcare Funders, and this is an organization that represents the majority of medical aid schemes in South Africa. The session and summit is very helpful. The breakaway session you've just heard, I think, brings to the fore the various issues that one has to look at when you're trying to solve the problems we have both in the public and private sector. Energies in many ways and good thoughts and brain power should be utilized to try and solve these issues. Sick and tired of hearing statements that private sector is working well, there's nothing to be fixed there, leave it alone. Sort out the public sector, and once that is sorted out, then you can come to us. That's not very useful. What is useful is to understand that there are problems in both sectors, and the people who access both sectors have difficulties. The 8.7 million lives accessing the private healthcare sector have got huge difficulties. The 42 million lives people that are accessing the public have got huge difficulties. Therefore, the government, and in this case the Ministry of Health, has a responsibility to see to it that both sectors are sorted out so that the people who access them can benefit from what is there. And if you look at the literature and everything, having a two-tiered system fragments what you have. You have to pool it and then make use of that pooling of funding and scale to begin to take the healthcare system forward and extract reasonable tariffs from those who provide healthcare. In this country right now, in total, we have about 300 billion rand. There's about 170 billion rand that the Ministry of Health gets from Treasury. There's another 130 billion rand that is collected in the private healthcare sector. So there's 300 billion rands in the kitty. The question is, with 300 billion rands, what are you buying? At what price? Are you getting good outcomes for 52 million people in this country? The answer is no. And the Section 27 of the Constitution says you need to do something about it. When it comes to the National Development Plan, what is interesting is that it mentions health as one of those issues that have to be addressed. And it mentions national health insurance as one of those models of vehicle that will be used. You can't talk about economic growth in South Africa if you're not going to deal with the healthcare plight of the people of South Africa. Whom are you going to use to develop or grow your economy? Whom are you going to train? If those people are sick most of the time, they won't be able to be trained. If those people are sick most of the time, they won't be able to work and generate the economy. So one of the things that you have to invest in to grow the economy is healthcare and education. And for them to get education, they must be healthy. So health is priority number one, number two, number three. And to allow market forces to determine that in the private sector, to me, is absurd. I mean, you regulate the price of petrol in this country. You regulate the price of electricity in terms of ESCOM. You regulate the price of telecommunication. You regulate the price of water. The logic for you to regulate that is because a human being in South Africa needs those things, can't do without those things. Health is even much more important than that. So why can't we regulate that? Because if we regulate that, we'll bring down a downward pressure on the costs of healthcare in this country. So for the NDP, National Development Plan, to reorganize healthcare and begin to talk about national health insurance, we in the medical aid industry, and BHF in particular, representing most of those medical aid states, we say, we want to play a constructive role, and we want to be an integral part of that, and we want government to recognize that there's a set of skills there, expertise, systems and processes that have been built over the years at a huge cost that can be utilized and leveraged on to implement the national health insurance. For government to start de novo as if there's nothing else in this country that can help government, I don't think is the right way to go. I think the private-public engagements around the establishment of the NHI, as talked about in the NDP, should be done along the lines of beginning to engage that expertise which is in the private sector, to work with government and led by government to implement the NHI. And we are here to play that role.